I knew nothing about the heart transplant process. In fact, the day that my cardiologist told us, I literally went home, crawled into bed, and pulled the covers over my head and just shook for a couple of hours. It was the most frightening thought that I could ever have, that something so vital to you has failed you.
So a patient diagnosed with a serious medical condition requiring something as grave as a transplant is anxious. They're usually in a state of shock. They're worn out, typically by the medical diagnosis that has led them to that point, and they need support, typically more support than a spouse or close extended family can provide. They need a medical navigator who can translate the language for them, help them understand and interpret the questions being asked of them, and help them make critical decisions that are necessary to proceed with their treatment.
The health navigator that I see in my mind is someone that has a certain degree of physician experience, that has a passion for patients in a longitudinal care fashion, that want to deal with the journey of a patient from the chronic to the acute, back to the outpatient, and hopefully the well side of things. And that's a special person that isn't trained for. There's no job description for that in our system currently. But again, is as important as anything that I physically do when I do a heart transplant.
A physician navigator would typically be with the patient for the first 2 weeks pre-transplant, providing critical interpretation of what the transplant process is going to look like, and then 6 weeks post-transplant.
The benefit of having a health navigator at the time of the transplant evaluation, it could be huge, have a huge impact on patients, their families, and outcomes. I think that our advanced heart failure team meets with patients and their families at a very critical moment in their lives. A lot of time we're meeting patients and their families for the first time when they're in the intensive care unit in our hospital, and with the machines and the noises and the severity of illness, it can be very overwhelming for patients and their family members. And I think having a clinical navigator to be present during the first encounters could be very helpful for the patients, their family members, as well as our clinical team.
Typically, admission to the intensive care unit as a patient is the first step towards recovery. It's really a symbol of hope, which is a wonderful thing. But for the family members, they see their loved one at the sickest they've ever been in their entire lives. They've been suffering from organ failure for a long time. Now they're in the intensive care unit, and they don't know what the next step is. I think that somebody in the unique role of health navigator can help fill that gap. They can reassure them, they can educate them on what the next step is. They can be there at their side whenever they're needed. That's an important role that currently is not quite filled.
A heart transplant in the post-op period at 2 weeks is typically discharged and given a clinical schedule to follow that can be overwhelming. On their first post-discharge visit back to the hospital, they typically start in the cath lab, where they have an angiogram, a cardiac biopsy, followed by an echocardiogram, a chest x-ray, laboratory testing performed in the lab, and a visit with the cardiology team in the outpatient office. Navigating this process is overwhelming, just logistically overwhelming. Trying to find the location, trying to remember which pills to take or not to take, trying to remember to eat or not to eat, and then being prepared to go through the testing. It's stressful, anxiety-provoking, easy to get lost, easy to miss the timing.
Having a navigator who really understands that part of the experience and understands the stressors that come along with the recovery process, I think is very important. And also being able to anticipate those stresses and anticipate the questions that patients will have is very important.
If they're having a particular symptom or sign and they're not sure whether or not it's significant, so the navigator is going to be helping them make decisions about when to report how they're feeling.
If there were a health navigator carrying you through the entire process, answering questions as you went, because you have limitless questions. And at times you almost have to give up asking them because they're so voluminous that you just put your hands in, or put yourself in the hands of the physicians and just go with it. But to have someone there to explain and have the time to explain why things are being done, the necessity of things.
Being familiar with the complex medical terminology that's used is essential. And a patient's coming to you at a critical time, almost being asked to pass the final exam when they've never been given the notes to begin with to study. And they can't do this. It's impossible, and they feel like they're gonna fail. And they feel like they're gonna fail at the most critical time in their or their loved ones' lives. You can see the stress melting away from them when you are there for them, answering these questions, letting them know that the questions they're asking are fine, and you can interpret the questions the doctors are putting to them in a way that's helpful and easier for them to manage.
So that last smile, that last touch, where the patient underwent 99% of what they needed to have done to be successful, that last 1% really matters. And we don't have a current system, process, or people in place to make that last 1 to 2% perfect. And it needs to be as perfect as the other 99 to 98%. And Health Navigators, I believe, allows us to accomplish that last mile to that level of experience and attention to detail that really means a lot.
Technology and science have come a long way in the 50 years since the first heart transplant was done, but the expectations on patients has not, and it is still a very difficult and challenging process, and the Health Navigator would really help to make that experience better for patients.